Welcome to this session of History of Healing. I'm David Stelfox, the Associate Program Leader for Naturopathic Medicine, and I'll be presenting this session topic, which is the expansion of alternative healthcare in the United States of America. In early 19th century North America, conventional medicine treatments relied heavily on surgery, bloodletting through lancing and the application of leeches, and the administration of strong toxic drugs such as calomel, which is another name for mercury. This heavy-handed or heroic approach to the practice of medicine drew strong opposition from many sectors, and consequently numerous alternative or irregular medical movements developed. So you had both regular medicine and irregular medicine being practiced freely at this time. One of these irregular movements was initiated by a somewhat colourful character by the name of Samuel Thompson. Thompson was born in the backwoods of New Hampshire in the northeastern United States of America in 1769. He grew up a farmer's son, a frontiersman, very self-assured, very independent and very self-reliant. At an early age, he was charged with the responsibility of looking after the family cattle, and so was left with a lot of time on his hands to explore the fields and woods of his home country. And over this time, he sampled the various plants of the region and became quite an expert in the use of herbs. He became such an authority with the way of plants that very early on in his life, around the age of 4, he had discovered the herb that would underpin his system of medicine. And this plant was called lobelia. Lobelia is a very powerful emetic, and emetic is a substance that induces vomiting. And lobelia is also potentially toxic, so that anyone consuming it runs the risk of serious poisoning and even possible death. You can see from the slide that some of the common names that are given to lobelia inflata are pukeweed and vomitwort and gagroot. So it gives you a bit of an insight into what sort of actions this herb can have. Now, young Samuel wasn't aware of this risk, and he delighted in playing tricks on his mates by encouraging them to eat parts of the lobelia plant and then watching as they turned very pale and sweaty. They experienced a wave of nausea and then vomited quite violently, and he thought this was a great trick. For almost 20 years, he used lobelia for his practical jokes without realising its medicinal knowledge, its medicinal virtue, or potentially its poisonous character. Throughout his childhood and his youth, he built an impressive knowledge of medicinal plants and also a growing scepticism of conventional or regular medicine, as it was called. And this was particularly fueled by two events. The first was at the age of 19, when Thompson injured his ankle with an axe, and the physician of the time, the regular physician that he went to, recommended amputation. And rather than have his foot removed, Thompson sought to build a poultice using the herb comfrey, and this actually cured his problem. And as Samuel stated, this was the principal cause of him taking up the practice of medicine. The second motivation, though, was the death of his mother in 1790. She had developed a cough, and that was diagnosed by a regular medical physician as galloping consumption. Galloping consumption was an early name for tuberculosis. This was then treated with a mixture of mercury and opium. And as Thompson said, the regular doctors, galloped her out of this world in about 9 months. Soon after the death of his mother, Samuel developed a cough himself, and rather than submit to orthodox treatment, he chose to treat it himself using the herbs that he'd come to know and understand. Well, the results were dramatic, and his health was fairly quickly restored. And these, along with numerous other personal experiences, sealed Thompson's faith in herbs as medicine. Through his experience and observations of the actions of herbs, Thomson developed a system of medicine based on his theory of how he believed the plants worked in the body. The Thomsonian system, as it was called, was based on two premises. The first was that the body had a central heater, and this heater was the stomach. The second premise was that this heater could be blocked by mucus forming in the stomach. And to clear the mucus, an emetic such as lobelia was employed, and then heat was generated or restored either by hot applications like heated bricks and steam baths, or ingested herbs like cayenne or ginger or black pepper. This combination was expected to restore the vital heat of the body and produce a cure. So the key steps were cleanse the stomach, overpower the cold, and promote free perspiration. And all this was based on the results of his clinical testing. It wasn't based on pure science by any means, more his own perspective or reasoning of his observations. Thomson was never a great writer, and he tended to express his teachings in quite simplistic terms, often in the form of poems like the one in this slide. In fact, it was left to a few of Thomson's followers, people like Benjamin Colby and William Fox, to more clearly and more thoroughly document Thomson's botanic system of medicine as it became known. The Thomsonian system of medicine comprised 6 groups of herbs according to their actions in the body. The first group was the emetic lobelia, which we've already looked at, or as Thomson referred to it, old number 1. It was really his favourite. It was the herb that he had become familiar with right from the age of 4. The second group were hot remedies like cayenne, ginger and pepper, black pepper, and their job was to retain the vital heat, the vital core temperature, and also to promote free perspiration. The third group was gentler, but still their purpose was to, as Thomson referred to it, scour the bowels and remove the canker, remove the disease. The first 3 groups were, their purpose was really to generate the vital heat, but it was recognised that they could weaken the patient quite significantly. And so gentler restorative or tonic herbs were used in the next group. So group number 3, we have examples like marsh rosemary and witch hazel. Group 4, referred to as bitters, herbs that have a bitter taste, and what they tend to do is to stimulate bile secretion by the gallbladder, and also to restore digestion. They enhance the liver function, gallbladder, and overall improve the digestive capacity of the body. And the bitter herbs that Thomson used in his system, they included things like golden seal, gentian, cinchona or fever tree, and also the bark of the white poplar tree. The 5th group were a syrup, and their purpose was to strengthen the stomach and the bowels, and they were made from either cherries or from peaches. Finally, the 6th group was Thomson's rheumatic drops, as he referred to them, and their purpose was to remove pain and to promote natural heat. They did that by improving circulation, and these drops were comprised of things like myrrh and cayenne and also brandy. Other remedies were also incorporated into the Thomsonian system, but they didn't fall within this number system. And they included a nerve powder that was based on valerian, and a very popular powder called composition powder. And this powder incorporated all sorts of aromatic herbs, including things like cloves and ginger and bayberry. And composition powder was used for treating acute infections, largely by promoting a fever to fight the infection itself. Combination of these groups and these different herbs were used to restore the patient to health, and these were either administered as orally or topically sometimes, or even as enemas in combination with steam therapy. Samuel Thomson was also something of an entrepreneur. He was gaining quite a following from the anti-calomel members of the community, who had created a strong demand for Thomson's herbal remedies. And recognising this, and also for the protection of what he regarded as his intellectual property, Thomson decided to patent the Thomsonian system of practice, including his herbal remedies. The system was promoted via papers and pamphlets and various other writings, including the books that Benjamin Colby and Dr. William Fox wrote. The catch cry of the Thomsonian system of medicine was every man his own doctor, or every man his own physician, which was a motivator for individuals to take responsibility for treating themselves, rather than relying on conventional or regular doctors who used poisonous metals and bloodletting and surgery, which Thomson claimed did more harm than good. The Thomsonian remedies, the herbal remedies, were generally dispensed by mail across the entire country, and following some basic training, agents for the remedies and the Thomsonian system provided medical advice and prescribed herbal treatments for any and all illnesses. In a way, this Thomsonian system was very similar to a pyramid sales structure, with Thomson at the apex of the pyramid, the public at the base, and the Thomsonian physicians, the middlemen in the structure. And these Thomsonian physicians were really agents who they bought into the enterprise, and then they returned a percentage of their sales back to Thomson. Each Thomsonian agent sold to individuals licences to treat themselves and their families, and these licences were called family right licences. Purchasing these family right licences also made them members of their local friendly botanic society, so that they could exchange ideas and exchange their treatments with fellow licence holders. Now, in 1828, Andrew Jackson was elected President of the United States, and Jackson was a frontiersman. He was a man of the people, and he was a rejecter of regulators. His view, and that of Jackson's administration, was that all things educated were the level of the aristocrat, and that regulation by the government was just another way of monopolising what should be open to choice. So, as a result, all licensure of medical practice was abolished, allowing people to choose their physician or their system of medicine. This fitted in well with Samuel Thomson, as it underpinned his ideal. By 1839, Thomson calculated that he'd sold more than 100,000 family right licences, and that over 3 million people from all over America had benefited from his system of treatment. Naturally, though, this popularity resulted in strong opposition from the regular medical profession. The regular doctors argued that whenever the regular physician lost a patient, in the opinion of the Thomsonians, it was the doctor's fault. But whenever a Thomsonian lost a patient, it was simply the way of nature. When one of Thomson's patients died by not following instructions properly, a Dr. French, who was a regular medical doctor, had Thomson arrested and thrown in jail. Thomson spent 40 days in prison before his case came to trial, but it was promptly thrown out of court because it was seen as simply an allopathic plot. The regular doctors considered the Thomsonian agent as something of an ignoramus with little or no education and a medical knowledge or medical training that was gained simply from pamphlets. So there was this constant stream of ridicule that was being delivered against the Thomsonian practitioners by the regular medical doctors. The regular doctors referred to the Thomsonian agents as the Knights of Red Pepper because of the inclusion of cayenne or chili peppers in almost every treatment. And the regular physicians scoffed that if the lobelia and cayenne didn't kill the patient, they might just kill the disease. But it was Thomson's death in 1843 that had probably the greatest impact on the Thomsonian system's popularity. There had been some degree of fragmentation within the movement over the years. Some of the Thomsonian agents were starting to wander from the fold and doing their own thing regarding implementation of the system. There were cases where Thomsonian agents established their own infirmaries, where they would take on the role of a doctor treating the patient under hospital-like conditions. The reaction and objection by Thomson and others was that this smacked of allopathy or regular medicine, in that it detracted from the Thomsonian maximum of every man his own physician. Additionally, a key figure in the Thomsonian movement, a guy called Alva Curtis, withdrew from the system's National Professional Society and established one of his own. One of the major differences of opinion within the movement was education, and Curtis and others believed that botanical medicine was a complex science and that it required formal and substantial training. Consequently, Curtis opened a school or a college in Columbus, Ohio, called the Literary and Botanico-Medical Institute of Ohio. This was in 1839. And it underwent several name changes and location shifts until it finally established itself in Cincinnati as the Physio-Medical College. Physiomedicalism was the term coined to reflect curing according to nature. And another 12 physiomedical colleges opened, and physiomedicalism took much of the steam out of the Thomsonian medical system. Without a leader, Thomsonianism largely declined in popularity, although there were pockets that continued, and its influences did have some impact on the practice of herbal medicine in the UK.